The Knoxville Area Urban League has been in place since 1968. It was started during the Civil Rights Movement, and at that time our role was to assist with the civil rights of African Americans. Since then, we've continued on that mission. We wanted to be able to get out into the community, notify people of opportunities for them, and in particular during the pandemic with COVID-19, we wanted to be able to make sure that the people who wanted to get vaccinated had those opportunities to get vaccinated. So we do that through pop-up clinics. We also wanted to make sure that they had information, accurate, truthful information about COVID and the impact that it would have on them if they were to get it and get sick.
We are concerned about the root causes of health disparities. We're concerned that a family who may be working can't even afford health insurance.
Today's event is about partnership, because see, that's what it's about. It takes us working together to make this happen. So here we are at the Urban League. We're going to have vaccines on site. We've got the University of Tennessee Hospital doing bone scans. We got bone density testing. We've got prostate screening. We've got mammograms. We've got hands-on CPR. You got things that you can use in your life, your everyday life. Opportunities for people who don't have insurance. They have an opportunity to get the screenings that they need. So once again, it's always about life saving, but it's about partnerships.
So by having more of these opportunities, having more of these events, we're able to bridge that gap.
HRSA helped us to train and hire community navigators who were trusted to go into the community and provide information to the community that were hesitant to receive it from majority organizations like hospitals or other providers.
Our community health navigators are people that live in their communities. They work in their communities, their families and friends. So people feel comfortable and confident listening to them and sharing and taking their advice.
The typical day for a navigator is to participate in the vaccine clinic that day by putting out signs, helping set up tables, helping pop up tents, and then providing information as people come about, because they do see, when you see the tent, they see the sign that says COVID vaccines here. People will stop and say, what is that about?
You know, people speak a different language now. We are an instant society. So while I do a lot of phone banking and then we now have texting, when I do social media, I'll go live. Like I just went live earlier today to tell everybody about this event that we're having here at the Urban League itself. What I've done is also set up an open window every day. If you got a question, text me here and I'll answer you. I'm all in. These are some of the ways that we've got to think about getting to the people that need to get that vaccine.
When I talk to people, I always interact with them with love. I always try to make it as light as possible so that they can understand that I'm not coming to them in a negative light and I just want to help them.
You know, it's easy for me as a physician, as a healthcare administrator, to talk about the importance of health. But I think when trusted organizations like the Knox Area Urban League start to establish health as one of their key strategic initiatives, that really raises awareness and hopefully should communicate the importance of taking control of your own health to the communities that are most at risk.
Is one day I was at the Kroger's getting groceries, and I heard a lady say, "Hey lady, you're the lady that saves lives." And when I turned around, she was pointing at me. You're the reason that I got a vaccine, because it was accessible in our community. I saw the signs, I saw the tent. That is a story that stands out to me. The lady that saves lives.
The one thing I would say is thank you to the Urban League on a national and local basis for trying to help the people, because at the end of the day, that's what it's about, helping each other.